Hi guys, welcome to Plastic Surgery Education. So today we'll discuss one of the most common questions which is asked to a plastic surgeon, which is, does plastic surgery leave scars? So the specific answer to it is yes. All type of surgeries, any plastic surgery is going to leave a scar. But the scar after plastic surgery, or rather I would say scar after the tissue has been handled by a plastic surgeon, scar after surgery has been performed by a plastic surgeon, is much better as compared to when performed by other surgeons. So I'll tell you the reasons why. So, as plastic surgeons, we are essentially groomed in, we are trained in the proper placement of tissue scars. To give you an example, if there is a scar over here, if there is a surgery to be performed in this particular region, taking a scar in this particular way, vertically oriented, or designing a scar in the natural skin creases like this. So the second scar, this scar is going to give much better aesthetic outcomes. So plastic surgeons are trained in designing the scars at the optimal locations which blend into the natural skin creases, thereby improving the outcomes of the scar. So this is one of the main reasons why a scar after being handled by a plastic surgeon is much better than as compared to those handled by other surgeons. Then apart from that, plastic surgeons are inherently trained in delicate tissue handling. We handle the tissues so very delicately. Our instruments are fine. We use very fine suture materials. Scissors, forceps are also very delicate and fine. So essentially, all in all, delicate tissue handling with very use of very fine suture materials also helps in improvement of the scar. Then apart from that, scar removal is also done at a very appropriate and early phase, depending upon the individual patients, depending upon the site where the suture is taken. So that prevents the hatch marks, or the risk of marks is minimized if the suture removal is early, and that depends on the appropriate level, appropriate area where the sutures have been taken. Apart from these couple of points which I have mentioned, that designing of the scar, removal of the sutures, gentle tissue handling, use of fine sutures, another important thing which is taken care by a plastic surgeon is post scar care. So the scar needs to be handled even after the surgery in a very delicate manner. A lot of scar care measures need to be incorporated. Some of them are gentle massage over the scar, use of silicone based creams, silicone based pressure garments, sun protection, and micro needling is there. There are a lot of other modalities of scar care which the plastic surgeon is trained in. These all form the part of the armamentarium of plastic surgeon, and because of all these things which are implemented in the scar care modalities, in the scar care measures, the scars tend to behave very well in the post-operative period as well. So I think scars are inevitable after any surgery. Those are visible signs that remain after surgery or after any wound. They tend to mature with time, they tend to blend in with time, they tend to minimize with time, but they still do remain after any particular surgery. So just a concluding remark, if you are wanting to have a good scar, consult your plastic surgeon. If you are wanting to get your existing scar revised, consult a plastic surgeon. A lot of factors, a lot of parameters are involved in the maturation of a scar, in having a good scar, some of which are under our control as plastic surgeons. Some are not under our control. They are tendencies of the body of the patient, like keloidal tendencies, hypertrophic tendencies, and so on and so forth. But whatever controllable factors are there, please consult a plastic surgeon to get a optimal and a beautiful scar in the post-operative period. So that's all for now. Thank you guys.